Wow.
Thank you.
Oh, no. Yeah, well, I hope everybody had a great Monday weekend. Before we get started here, I took some of your feedback and decided to make a quick little cheat sheet with all the acronyms going over all of the key terms and concepts we've been talking about for these past couple of months. So whenever I throw out terms like BACB, NCR, DRA, DRI, now you have a quick reference to all those important terms, and I try to make sure they're as simple with pretty straightforward examples. And this should also aid for those who are interested in taking the exam.
Yeah.
Well, what's your verdict, Willie?
Thank you very much for this.
My one regret is I didn't get sooner. Okay. Yes, so that's there for you guys for your convenience and reference. For those that have taken a look through, does everything seem clear? Any of the other terms need some clarification? For the e-term handout? Looks good?
ABA.
Okay, great. Awesome.
ABA.
Which one?
ABA.
Did I not include ABA?
I'm looking.
You're joking. I did not include ABA.
You did not.
Yeah, there's no
There's no ABA. Okay. Well, I'll make a slide for it this
Okay.
Thursday for you to be able to write in. ABA, simple way to put it, is just the science of behavior applied to changing behavior in a socially significant way. That's the key term when it comes to ABA. Changing behavior in a socially significant way, or a way that matters. That is probably the best way to explain ABA.
Yeah.
And for an example would be
Generalization.
teaching a client to make requests and then using reinforcement to get them to make the request more often. Okay, that underway, how about we get back into ethics?
Okay.
Yes, really important for us to act and behave ethical. Last time we were going over the various ethics codes that both RBTs and BCBAs have. Now let's take a look at what are some of the guiding principles behind those ethics. None of this is in that. It's just a brief overview. We're going to be spending all our time also discussing cultural humility and responsiveness. So let's get into that. So we mentioned this earlier in the ethics code, but this is something that the curriculum requires us to go into a little bit more depth on. So why do we do so? Cultural humility is this acknowledgement that while you may understand and are very familiar with your own culture and practices, that isn't the same case when it comes to certain clients who may come from a vastly different cultural context that we do. And part of being effective at what we do as professionals is understanding where those differences lie, so then we don't let our own biases get in the way of properly serving and being there for the clients. Let's take a look at what that may look like, or another video on this idea of cultural humility.
One word to describe cultural humility for me is love, actually. If I had to encapsulate cultural humility, the whole concepts of cultural humility, it doesn't do it justice, but the word that I think of it is essence.
Escuchar.
You.
Opening. Receive. Compassion.
Love.
The principles of cultural humility offer one more framework to contribute to what has got to be our ultimate goal. Yes, our ultimate goal is that there will be a sense of equity, a sense of equality, and a kind of respect that we are driving forward.
Cultural humility that is a multi-dimensional concept, and certainly Melanie Tervalon and I conceptualized 3 dimensions.
The first is lifelong learning and critical self-reflection. And in that critical self-reflection, it is the understanding of how each of us, every single one of us, is a complicated, multidimensional human being. Each of us comes with our own histories and stories, our heritage, our point of view. You're looking at me now. I am very fair-skinned. When I was a little girl, my hair was blonde. My eyes are blue. People often try to call me anything but African American. I have a history. My identity is rooted in that history. My parents gave me the knowledge of my own social identity, and my own experience in life has created that. I get to say who I am.
The second tenet, after self-reflection and ongoing lifelong learning and development, is this notion that we must mitigate the power imbalances, to recognize and mitigate the power imbalances that are inherent often in our clinician patient or clinician client or service provider community dynamics.
And then finally, the piece that I would offer that Jan and I feel people often either don't read or don't like, which is, and the institution has to model these principles as well.
So that's that. And I think it just in terms of the day in and day out, it's just more important to recognize that those things are prevalent. But at the same time, that doesn't mean we can't take opportunities to be able to share our own culture with the clients and then also have this reciprocal experience where they may share something with us. I think it's always a nice thing to visit a care home and seeing one of the clients request a song in Tagalog, for instance. Yeah. And then, yeah, they listen and they sing along, and it's great. And everybody having a good time because there's this thing that they're able to share. But yeah, come back to this idea of cultural humility. Like the video said, it's acknowledging some of the biases that may get in the way of seeing the client as the individual person in front of us, seeing as their experience as something that's valuable, something that we can ourselves learn from. And when we learn something new, then we're able to respond differently, behave and act in accordance with what is meaningful, what is valuable. So let's go through an example here.
Yeah.
Let's say an RBT is working with a client where it is inappropriate or disrespectful to look somebody straight in the eyes.
Disrespectful.
All right. Yeah. There's some cultures where it is disrespectful to look somebody in the eye while you're speaking to them, where others, specifically here in America, where it's actually rude if you don't look somebody in the eyes. So that's a little bit of a cultural variance. So here, the RBT may be thinking, okay, because we live here in America, in order to show people that we're listening, we have to look at them in the eye. The client's not doing that, so we have to teach them to do that. So that's why he comes up with this idea, okay, every time he's interacting with the client, oh, look at me. Look at me while I give you an instruction. So then something that would make this situation more ethical, much more practicing cultural humility, would be for the RBT to go to his BCBA or his supervisor and say, oh, hey, the client isn't looking me in the eye. I find that kind of strange because in our culture, we see that as something that's necessary in order to tell if somebody's paying attention to you. So keeping that in mind, the BCBA will then revise the goal because it is important for us to be able to recognize when somebody is listening or attending to us. And this would either be with just changing how we can tell they're listening, or that be orientate their body facing you or towards you. So then they see, okay, yes, they are listening, or giving a verbal indication such as or yeah. And if they do those things, they don't have to look at you in the eye. And their cultural practice there is maintained. How great. Yes. Speaking of applying cultural humility, that is what we describe as cultural responsiveness. And I'm sure you guys have seen this already, but let's say you're working with a client and they have their picture board that they're communicating with. You don't want to just pick random items from that you find online, stock items. No, you want to use things that are relevant to them, and more specifically, if it's more relevant to their cultural practices. So, for instance, for utensils, maybe they're coming from a culture that doesn't use spoons or forks, and they mainly use their hands. Or maybe we would like them to target chopsticks if that's something that's more common in their culture. Let's take a closer look at cultural responsiveness here.
Hi, my name is Neve Overend, and I'm a board certified behavior analyst with Professionalism Associates. In this video, we'll be talking about an introduction to cultural responsiveness. Cultural competence is the ability to understand, appreciate, and interact with people from cultures or belief systems different from our own. When practitioners incorporate cultural competence into treatment, it may lead to improved outcomes, increased client satisfaction, and motivates clients to be equal partners with their clinical care team. Increasing cultural understanding and diversity in applied behavior analysis is critical to a culture responsive treatment. Ethics Code for Behavior Analysts, updated January 1st, 2022, includes Area 1.07, Cultural Responsiveness and Diversity. Some examples of increasing cultural responsiveness into practice is to consider various cultural practices as you conduct assessments, such as self-care, asking if the client wants to shave their hair, for example, feeding, what utensils are used to consume meals, whether it's a hand, fork, chopsticks, etc. Sleep patterns. Remember, bedtimes vary from household to household, and not everyone has their own bed in their own room. And toileting, whether, for example, if an individual stands up or sits down to avoid. Goals targeted for both increase and decrease should be aligned with the client's family values. This may include primary language, family dynamics, holidays, religious and spiritual beliefs, and also level of independence. This addresses aspects of social validity as well. Furthermore, cultural responsive classroom management provides all students with equitable opportunities for learning classroom management in the service of social justice. In 2020, an article in the Journal of Applied Behavior Analysis reviewed reporting of demographic variables. The researchers found that demographics such as developmental function level, education level, test scores, race, ethnicity, language, and socioeconomic status were underreported. Underreporting of demographic information does maintain the confidentiality of participants, but underreporting of demographic information is problematic, may lead to misrepresentation, important variables may be overlooked, and may hinder adherence to our code of ethics. The demand for behavior analysts to serve consumers with diverse cultural backgrounds is increasing. There's a need for culturally competent behavior analysts to support the needs of an increasingly diverse population. Increased demographic information will assist behavior analysts in developing culture responsive behavior analytic treatment. As demographics continue to shift, so should the practice that responds to client needs. The assessment of culturally sensitive practice and behavior analysis is a good resource to use when working with a client whose cultural background is different than your own. The algorithm is a decision tree with a series of questions to help practitioners determine if they should proceed with a culturally sensitive intervention, refer to a qualified professional, or seek further training, then reassess. Please subscribe to our YouTube channel and disseminate the science. Share.
You don't have to use that. Yes, so some other examples of using cultural responsiveness include, kind of create that space to allow the client to share what they're passionate for. So for instance, giving that opportunity to play, Vietnamese music during music appreciation, for instance. Yeah, and like I was mentioning earlier, considering that functional skills are actually pertaining to their cultural context. So something that I was doing when I was in RBT was helping the clients learn how to shop. And we would mainly do this at a Trader Joe's where their family would often go to. But you can imagine if that same client came from a different cultural background where they had to go to a specific ethnic store. And it wouldn't really help to generalize if we only shopped at Trader Joe's instead of these more foreign stores that they would probably be going to more often. For instance. So just because something's functional doesn't necessarily mean it's outside the context of culture. Anything has to be taking that into consideration. Okay, so that is cultural humility and responsiveness. So just to summarize, cultural humility is that recognition or appreciation for a client's different cultural background than our own. And cultural responsiveness is being able to act according to what we know about their culture.
So,
Yes,
I got a question about cultural thing, you know?
yes,
The word there are a lot of people with different backgrounds. They will refer you're a racist
mhm.
if you don't conform to what I want.
So what's the question with that?
The thing here is a lot of people are using this when they don't want to agree with you.
Mhm.
You're a racist to me.
Because you don't want me to conform to your standard,
culture.
your culture. Okay, well, it has to be a give and take.
Mhm.
You can't just say, "Oh, you have to accept all of everything that I want," but I won't do anything. I won't do the exact same thing. That's very hypocritical. And I would say, in this context, and again, professionals, we want to show people dignity, compassion, and understanding, not just to the client, but everybody else. I think we established that last week. That also means taking into consideration cultural differences. And I would say, at least from my point of view, I have grown to appreciate your guys' culture and some of the great familial practices that you guys have, and be able to see how I can accommodate my practice with interacting and cooperating with all of you. So for instance, and maybe there might become time where you guys could do the same for mine. I don't know. We'll see.
Because if you don't conform with what they want, they would say, you're a racist. They don't want me to be in this particular situation.
And
you
those
are always getting the upper hand, not me because the color of my skin.
Yes. Yeah, those people are going to be hard to work with one way or another. At least for us, we can be mindful.
And then that now is being dragged into politics.
Yes. Yes. Politics right now is outside the scope of what we're covering.
I'm not saying that it goes into this game.
No, I understand. But yeah, it's just being about aware of these things. Being aware of them. You don't have to necessarily take in it all. So just have to be understanding that there is some differences. I think. What was that like? You're gonna say something?
Yeah, because what you discussed with Tanduk is cultural humility or for both two person, which is normal.
Yes.
Okay. So how about in our situation here? How could we know this cultural humility? How could we apply? Can you give an example on how?
Yeah. So first,
of course, don't mind the two good person. Should be the client, what we had over here, and we the service provider.
Mm-hmm.
So what type of cultural humility that we're going to?
Yeah. So something that you could do concretely
among our people here. Can you give an example then?
As far as the clients?
Yes.
Okay, yeah. So for instance, for clients that we know come from a vastly different cultural context, someone like Adrian or Robbie, who we know that those cultures have dietary restrictions and different practices. we would then want to reference their IPPs to see if those differences are prevalent. For instance, not being able to eat pork.
Correct.
If there is a client who, let's say, is eating a ham sandwich, and they're offering it for whatever reason to someone like Robbie or Prasad, and we know that they can't eat pork, then it is only right for us to intervene on that. Indoor too, yeah.
Yeah, so it's clear.
Yeah,
Because
for
when
someone like
we're discussing about the caregiver to the client, forget about these two normal people.
Two normal people.
We know already how.
Yeah. Again, you don't have to buy into everything that somebody does or believes in, but just being aware that those differences are there is sufficient to work and cooperate as professionals. Yeah, but this is more so for how we do it with clients. Because at the end of the day, they're the ones that are receiving the services. Yep. No, great questions. Yeah. And I think yeah, I mean, some of the other clients, I would say the majority of clients don't have.
Another client, culture of Brandon Miller.
Yes.
Yeah.
Yes, I would say the vast majority of most of the clients may not have their cultural background as an obstacle.
Like Philip, we don't know what culture that you got.
Yeah. For some clients who may have been just raised in a residential facility their entire lives, may have not necessarily had the opportunity to develop a cultural identity within their ethnic context.
Correct.
So for them, it would be much more difficult.
PG? Philip?
PG?
Yeah.
Fijian?
Fijian?
Yeah, Fijian.
I think so, Fijian.
Yes.
How about the same thing with Charles?
Charles is African American.
African?
Yes.
Charles?
Yes. The other one.
He's an Islander. I thought he was an Islander.
No. It's African American.
So this is when applicable. I mean, this should be in mind always when dealing with anyone, including clients, right?
Yeah.
So
of course.
It's on a case-by-case basis.
Amanda is Korean. Angkao is Vietnam.
Vietnamese, yes. Yeah, and I think, Jessica's Honduran. Jessica?
There's another ethnic.
She's from Honduras. Yeah.
Honduras. Who's from Honduras?
Jessica.
Jessica?
Yes. She was born in Honduras.
So it's the race is Honduran.
Yes.
Latin American.
Yeah, exactly.
So we don't know.
My name.
Hey, you ever heard that? Her IPP. IPP
Yeah.
guys reference it.
Of course, Jonathan, we know, Filipino.
Yeah. Yes, all of us. Felipe.
And who was the other with race? Diversified culture.
Yeah, we can come back to discussing all of the clients, nationalities, and ethnicities. But yeah, all right, come back to this. So now we're going to talk about the confidentiality again. I know we've already talked about it for the codes. But yeah, we can also just recognize just how disclosing the information does a lot of damage to the clients, because it kind of does release information that shouldn't be out there. So this would be some concrete examples of what breaching confidentiality would look like. Let's say you're at the grocery store and then you tell a clerk about a client's diagnosis to them, which explains why they're acting the way you do. There's no reason for them to know the client's diagnosis. And then same thing when talking about clients' harm behaviors, just out in the open, not just with other clients or peers present, but pedestrians and bystanders. There's no reason they should be able to know or hear that. Then something else that is important that the code emphasizes is, and yeah, keep in mind, this is not something I would ever accuse any of you of doing. This is just something that's part of the ethics curriculum. So it's just something to be aware of. But yeah, misrepresenting your credentials. More often than not, it's not a good idea to stray away from saying you're something you're not. Because if you have someone who is in a position like an RBT, and then they're claiming that they're a behavior analyst, and all of a sudden there's all these unreasonable expectations that are placed on them, and they can do a lot of real harm because they don't have the experience or the training or education to properly make clinical decisions, for instance. And plus, it's just not right to lie. I think that's something we can all agree on. Honesty is important. And then this will be pertaining to, using social media to make outlandish claims. Now, there are actual companies that have done this, or they say, oh, our ABA clinic is so good, it'll cure autism. Something similar to this example where it's for adult clients. And of course, you have people who may hear that and then think, oh, this is exactly what we've been looking for. But then they go in and they realize that is not exactly what's going to happen. Instead, what we are doing here is tracking progress, monitoring, ensuring that we've put the goals in place so then there can be growth, but there are no cures here. Again, because that is deceptive, deceiving, and we should not lie. When it comes to internal matters, we want to be able to properly address misconduct on part of ourselves. And I'm sure you guys have already heard this ad nauseum by Jan and Vaughn. Let's briefly go over this. And again, not making any accusations, not saying anybody has done any of these things, but it's something that we do have to cover, since misconduct is something that's heavily scrutinized in the ethics code. Yeah, so one of the reasons it's important to address misconduct would be to prevent smaller issues becoming bigger ones. And this, just as we talked about procedural drift, where when we initially began in intervention, it slowly started going to something it wasn't. Same thing when it comes to behaving ethically. One instance where playfully, making fun of a way a client vocalizes or speaks can become into real verbal abuse later on. So that's something that we have to be mindful of. And as you guys are well familiar, these clients are a vulnerable population, which means most of them, if not the vast majority, have had a history of abuse and trauma. So instances where we're not aware of these potential triggers can serve to be detrimental to their well-being. So just like a little cultural understanding, recognizing clients' diagnoses, especially when it comes to seizure disorder and epilepsy, can be very important to keep in mind, so then you know what to monitor for if the client begins to exhibit some of the signs of having a seizure. That way you can act quickly and ensure they can recover soon. Just as we are all professionals here, want to be respectful to one another, but then we also want to keep each other somewhat accountable, because at the end of the day, we're all here for the clients. So being able to, kind of create a culture where we're lifting each other up is going to create this team dynamic that can lead to being there for the clients. So whether that be completely being mindful the moment, reminding peers that, yeah, put their phone away for that moment, because they may be having instances where they're having to actively monitor the clients. Can be a good way to avoid mishaps from happening. Again, not accusing anybody of doing these things. I've not seen these things at all, which I'm glad, because as you can kind of tell, some of these are pretty cool. For instance, delaying changing somebody's briefs as a consequence for wrong behavior. Yes, or just changing their garments, their diapers.
Diapers.
Yes.
This is
Yeah.
the
Yeah. I'm not going to change it because you acted bad. We do not do that. You can see just how kind of cruel that is. And then taking one of their snacks because they didn't finish it. Yeah, again, not something anybody would ever do. Definitely clients. Clients may do that, but certainly not us. So in any of those instances, it's important to report and then follow the mandate process. Okay. Was that too quick? Any questions on misconduct or confidentiality that we did not cover? Okay. Let's summarize the piece on cultural responsiveness. This is our way of adapting the way we respond to clients. That way we can be as compassionate and maintain their dignity throughout it all. And then see misconduct, you guys know to report it immediately before things start from something that's very small to bigger issues later on. At this point, I think we're all familiar with the documentation process for that, how to report it to supervisors.
misconduct.
Yes.
The DSP. Will be a reflection of the biases intervene for the professional misconduct immediately.
Okay. Not if it was just me, but I kind of felt as though the room got warmer as we were going through this. So how about we get to the questions now? Good. Okay. Which of the following best describes cultural humility in a professional setting? Just attending a 1-hour workshop, memorizing a few words, native language, ignoring it. I'm hearing D. D or D?
D.
Let's see. Well, how about that? Just like in the video, lifelong committed self-definition and upholding. Yes. Yes. A 1-hour workshop is not going to cut it, unfortunately.
Self-evaluation.
Yes.
Which self? Yourself or himself?
Oh, you're yourself.
Yourself.
Yes. So, I'm encountering this person who has a different cultural background than I do. So let me understand them better, so then I can know how I
Yourself
can respond to them. Yes. Self-evaluation. It's something that we should be, I would say, doing in general. Not just when it comes to cultural. And RBT is working with an adult client whose family's culture values indirect communication. How should the RBT apply cultural responsiveness? I'm hearing a lot of B adjusts. C, yes. I actually had to look up what indirect versus direct communication was. I would say, yeah, our culture in general prefers indirect. It's direct would be more, I need you to do this by 5. Indirect would be, I would really appreciate if you could do this by 5. So it's a little bit more subtle, a little bit less direct. Yeah. Which of the following constitutes a breach of client confidentiality on social media? So I'm hearing.
Yeah, letter A.
Everybody agrees on A?
Yeah.
Okay. Yes. Yes. C is, I mean, why would you do that? Same thing with D. B is okay. B you could do. I recommend doing B. And RBT introduced themselves to the new guardian as a behavior analyst. What is the risk here? Hearing C, I'm hearing A. What else am I hearing?
C.
It is C, guys. Great. Misrepresents your professional credentials, creates these unrealistic expectations, and plus, one of the big things in the ethics code I would say, just in general, don't lie, tell the truth, be honest. Okay, I think we have 2 more. A day program staff member promises a client's family's AB will cure their loved one's disability. What is this an example of? Oh, I love it. It's like a choir. Yes. A. Misrepresenting client outcomes. Will A be a help? Oh, absolutely. But will it be a cure? There's no cure. Last one, guys. In the context of adult day programs, why is cultural responsiveness especially important for functional skills training?
D.
Let's see.
Let's look.
Ooh, you guys did a clean sweep here. Yes. Yes. Functional is based on culture and values. Yes. It's all about the environment.
Culture.
Yes. Yeah. So that's the portion of ethics. I think there is a little bit left for us to cover on Thursday. And then we should be nearing the end. Could you believe I had to take an entire class on this stuff? Lasted for 3 months, many case reviews, many things, and all kind of boils down to be professional, don't lie, be honest. What we can do. All right, well, that is it. Yes, Ruben. She's holding you hostage. She's holding you hostage.